All right, hello and welcome to our webinar, How to Manage Your Healthcare Team as an Adult with Tourette Syndrome. My name is Marissa Hsu, and I am a program lead at the Tourette Association of America, and I will be your moderator for tonight's webinar. During this webinar, participants will learn helpful tips and information on managing a healthcare team, including information on who makes up a healthcare team, how to disclose to providers, how to organize a care team, and how to manage appointments and care. Participants will have the opportunity at the end to ask questions of the speakers. Please use the chat function to relay your comments and questions to the speakers. At this time, it is my pleasure to introduce our speakers for this webinar. Dr. Katie Kompoliti was born in Greece and completed medical school at the University of Patras Medical School. She completed her residency in neurology at Northwestern University in Chicago, then a fellowship in movement disorders at Rush University Medical Center, also in Chicago. Dr. Kompoliti became a faculty member in movement disorders in the Department of Neurological Sciences at Rush University Medical Center. Her clinical interests as a principal investigator have focused on several therapeutic areas, including studies to evaluate the safety and efficacy of new compounds to treat Parkinson's disease, Tourette syndrome, and functional movement disorders and dystonia. And the next speaker that we have is Tonia Alvarado. She is a licensed mental health counselor and owner of A New Path Counseling with over 10 years of experience. Tonia completed her undergraduate education in psychology at the University of Central Florida. She went on to obtain a master's degree in mental health counseling at UCF. Her therapy approaches include cognitive behavioral therapy, person-centered, and solution-focused approaches. Her specialty and passion is working with the tic and Tourette syndrome population. Due to having loved ones with a diagnosis of Tourette syndrome, she developed a passion to help those individuals and their families gain insights, tools, and radical acceptance for life with TS. Tonia is a CBIT certified provider for the TAA and has extensive training and experience with tics and Tourette syndrome. So without further ado, I will hand it over to our presenters for the presentation. Thank you.
So good evening, I'm Katie Kompoliti. Next slide, please. And I'm going to spend the next 20 minutes or so talking about how to navigate the healthcare system as a patient with Tourette's and tics. So, like, as anyone knows who ever had any medical problems and had to navigate the healthcare system, this can be a very daunting process because there is a whole industry and that revolves around the patients that sometimes can be difficult to navigate, even for people like me who are, work in the healthcare system. So around the patient, there is the healthcare team, and this includes the healthcare providers, the family, and any kind of support the individual has around them. And the biggest circle involves the infrastructural resources part of the equation, and that includes hospital, clinics, nursing, etc. And all this is surrounded by the regulatory, market, and policy framework. And this, as we all know, is getting bigger and bigger every day. So the next slide, please. So every person with living with a chronic condition can have a daily challenge navigating the system. So we need to learn how to create a toolbox for self-management of the healthcare team. And so we can, the individual can have less stress and better outcomes. Patients need to know how to manage the symptoms, recognize emergencies, and use the healthcare resources efficiently. Next slide, please. So, but the kit is something that is not like a cookie cutter, is not one size fits all. Every patient has to develop their own toolbox, and that includes to deal with problems like frustration, fatigue, pain, or isolation, appropriate use of medications, effective communications with family members and healthcare professionals, decision-making, and learning how to evaluate new treatments. Next slide, please. So I'm going to spend 5 minutes, I promise, not more, talking about Tourette's. And I'm going to start with this ubiquitous slide of the iceberg. And we all know that Tourette's is not only the tics, is all the bigger part of it is what we call comorbidities. Next slide. And these comorbidities include ADHD, OCD, or either the disease or behaviors, mood disorders, non-OCD anxiety disorders, impulse control disorders, and substance and alcohol problems. Next slide. And this is a very nice slide that shows that the more severe the tics towards the right end of this graph, the more you tend to have all the other problems that come with Tourette's, which we usually call the psychiatric comorbidities. Next slide. And this is a slide you've probably seen before, giving you a flash of the natural history of the disease. So the tics start in childhood. Supposedly, they kind of, the peak is around 10 to 14, which coincides with puberty, and then around 50% roughly. All these numbers are not written in stone because the studies are imperfect, but around 50% they're going to have no tics. 20 to 30% we have less tics, and 5 to 20% they're going to continue having same or more severe tics in adulthood. And ADHD is something that starts in childhood, is sometimes maybe one of the first things we see, and has a bigger impact in childhood, maybe less impact in adulthood, but that's been challenged recently. OCD starts later and has more impact later in life. Next slide. So the sources of disability in children versus adults can be different. So even though some say tics improve with age, adults with tics have significant problems with self-image, social adjustment, social anxiety, and incorporation in the workforce. The presence of psychiatric comorbidities can further worsen the course and raise issues about how people should be cared for by specific disciplines of medicine. Even though the literature is not conclusive, we know that tics usually is not the main source of disability or difficulty in childhood, but when they persist in adulthood, they're often the major source of impairment. It's unclear how many patients continue to have problems in adulthood because the only information we have is from the patients who seek medical attention. The patient organizations tend to be geared towards children, so usually the adults are kind of left out. Next slide. So in summary, tic severity in childhood is a strong predictor of increased tic severity in adulthood. ADHD is a major factor influencing function in school age children with Tourette's, but can be a source of disorganization in adulthood, and that sometimes makes it harder to own your healthcare and navigate through the healthcare system. OCD appearing later can be more persistent and disruptive in adulthood. And these to date, there are no data confirming that more aggressive treatment of psychiatric comorbidities in childhood will improve disability in adulthood. Next slide. So the fact that Tourette's sits in between two worlds or more than two worlds sometimes makes it hard to have a single doctor who's going to take care of your problems. So Sometimes just a neurologist can take care of the problems, but sometimes just the psychiatrist. I have patients where the psychiatrist sends them to me just for the tics while they're treating all the other issues like the anxiety, depression, etc. But so a neurologist and or a psychiatrist should be part of the team. A psychologist and or other mental health providers are very important because we have very robust treatments to address some of the problems without giving people medications. And the nurses, the medical assistants, and finally, all these what we call complementary and alternative medicine providers that are out there and patients seek help from. And this, in the more recent, is called integrative medicine because in many instances can work together with mainstream medicine, so to speak. Next slide. And this part of medicine, can be subdivided in different types of treatments, like the mind-body interventions, the other kind of manipulative somatic treatments, like osteopathy, like massage or chiropractors, and so biologically based treatments like diets, different supplements or vitamins, or energy treatments, or an alternative medical systems. So, and all of these or combination of those have been used from patients, and some of them have been studied by doctors. Next one, next slide, please. So what are the different treatments offered in Tourette's? One of the biggest things we do sometimes, but that's more important in children, is diagnosis and talking about the future. And that can be sometimes a form of treatment. People, as long as they know what they have and how to manage it, sometimes when it's mild, they just live and learn to live with it. And that's, and you see that more in children, but I think it can be true in adults too, especially those rare cases when you have onset of tics in adulthood. Behavioral interventions, and this is something we, over the last 10, 15 years, since CBIT came around, is something we offer firsthand for every patient, because learning, people with Tourette's and tics go around with a body that doesn't obey them, but learning techniques of how to make that body obey you is something that everybody should have in their ammunition. And whether it's enough at this present time or is something that you're gonna just pull out of your sleeve in the future and just learn how to use it through time, is something that everybody should try. Then medications, if we have to. I personally do a lot of botulinum toxin injections because that this is something that it's a form of treatment that doesn't go into your brain like most of our drugs. It's very local. It's not a pill you take every day, it's something you do every 3 months, but it's limited because it's a very localized treatment. It can only address certain problems. Very severe cases go to surgery, but that's still, again, is brain surgery. The deep brain stimulation, when you insert a little pacemaker in the brain that supposedly can alter the network and result in less tics. And that's kind of a very complicated issue. It's done only in very specialized centers. It's not directly, it's not approved by insurance, and it's something like something of last resort. The complementary and alternative therapies, whether those are something, they're still pills like supplements you take and expect to make you feel better, or are things you learn how to use in your life, like mindfulness, yoga, which are active processes where you learn how to control yourself, your environments, and your symptoms, are very much in play for as treatment options. And finally, research and clinical trials. Next slide. So a person who, has a problem that's big enough that requires that you go to a medical, to a health provider, has a lot, they have a lot in their hands. They have to manage appointments, manage their electronic medical records. They have to manage the pharmacy, the financial aspect of it, and any tests they have to do. So it's sometimes, as I said in the beginning, a daunting process, and especially when doctors start referring you to other doctors, it can be very hard to keep up with. Next slide, please. So whenever you go to a doctor, you have to be prepared. You have to be able to disclose how you feel and your symptoms and what brings you here. You have to, what brings you there. You have to share any symptoms you have. Be clear and concise when describing the symptoms. Be honest. This is not a popularity contest. I have a lot of patients, with Parkinson's who come in and they walk down the hall and they say, am I good today? And the family says, no, why can't you walk like that in the house? So you don't want the doctor to see your best. It's better if they see your worst. Just let it out. And tell the provider about your habits and that be honest about those. And those include, alcohol, or cannabis, which is very popular these days, and all other habits that may influence your symptoms. Report all medications and supplements because they are all act at some chemical level and they have interactions with each other. Share any concerns you have in the personal life that may affect your problems, and take notes before, during, and after the visit. Next one, please. So before you go to see somebody, you have to ask yourself, do some soul searching and ask some questions. One, what exactly are my symptoms? You need to do a tick inventory and be ready for that. Decide whether you have orchestrated bouts of tics, how complex are the tics, whether you have tic attacks, and are the symptoms constant? If not, what makes them come up? What makes them better? And what time of the day do they happen? Do they affect your daily activities? Which ones and how? Because, if you tick here and there and you're very, you're at ease with yourself, and we are not gonna treat you for that. You don't treat symptoms, you treat disability from symptoms. So if the tics affect your personal life, your family life, your romantic life, or your academic or professional life, that's when you need to intervene and be more aggressive. Next slide, please. So let's try to walk through the visit. So when you make your appointments, explain on the phone clearly why you need to see the doctor. You don't want to go to a doctor and find out there that you're at the wrong office. Make sure that the provider accepts your insurance, because from personal experience, I know that we're not always told that. You may go somewhere and find out after the fact that you're out of network. And that's not as important for doctor visits as it is for tests. So gather any past medical records and family medical history. Write down a list of your symptoms before the visit and keep a diary charting symptoms over time. Detail the location of the symptoms. Where do you have, what body area do they affect? The quality, what does it feel like? The spread, And that comes back to the inventory of tics. At the scale, how bad it is, how much does it affect you, the timing, when does it come up, how long does it last, does it come and go, it's gradual. When it started, was it gradual or sudden in onset? What makes it better or worse? And any other symptoms you have, which is tic attacks, would be again the main obvious one here. Set an agenda at the start of the visit, on the visit, and this is your time, and you need to set the agenda. Because I read somewhere when I was researching this presentation that you have 27 seconds to tell the doctor what you have, because then their doctors have their agenda too. I know from myself. I mean, I have a list I need to go through, and I try to go through because otherwise I forget. So try to be in charge of that visit. Bring a list of all the medications you're currently taking, including over-the-counter medications, vitamins, herbs, and supplements. And take records, or use your smartphone to record it. I have a lot of patients who ask for that, and I'm fine with it. Or I have people who have their loved ones who couldn't come, kind of follow the conversation through a smartphone. It's perfectly fine. Next slide, please. Because we think we understand, but sometimes all the information can be so overwhelming that you walk out and you don't remember exactly what you were told. And medical care is a conversation. Be part of the conversation, speak up, and own the visit. Bring a friend or a family member. 2 years are better. 2 sets of ears are better than one. And as I said before, if nobody can come with you, just record it and listen to it again. Always be honest. Ask the doctor to explain the test results and request a copy if they're there. Be sure to understand what needs to happen next. Treatment options, diagnostic tests, how to contact the provider, reading materials or websites if they're available. If you've been given a prescription, make sure you understand how and when the medication should be taken. Are there any side effects you should watch for? How will you know if the medication is working? What happens if you miss a dose? A lot of times nothing happens, but you need to know that, because for some drugs it might. After your visit, review and file your notes along with any test results. All this kind of you have to adapt to your personal style. Some people don't like taking too many notes, so it's fine as long as you have an agenda and know what you need to take out of this visit. And schedule any follow-up tests or appointments right away. Doctors are busy these days, so access is a big problem in healthcare, especially with psychiatry. So it's easier to cancel an appointment than it is to make an appointment. So just make that appointment. Next slide. So living with a chronic disease or condition is like flying a small plane. If flown well, one gets to the destination. If flown badly, either crashes or lands shakily in the wrong airport. And that makes you reluctant to leave the ground again. Next slide. So you own this disease. And when you fly that plane, it's part of who you are. And there are, bad and good things about it. So when you fly that plane, take ownership of that plane. Learn about and understand your condition. Find the right providers for you. Learn to speak and ask for help regarding your emotional health. Accept your limitations and challenges. Define your circle of support. That's very important in life in general. Know whom you can count on. Identify what's important to you and gives your life meaning and purpose. Practice mindfulness. And that's easier said than done, but I think puts us at a different level as individuals. When we're able to do it even for a few minutes a day. Exercise is an essential part of physical and emotional health, and it is vital for your spirit to find ways to have joy and to have goals, both big and small. And sometimes life, the God is in the small things, which are always there, when the big things don't go our way. Next slide. So that toolbox is also yours, and you have to make your own. It's not nobody else's, and you have to customize it according to your needs. Next one.
All right. So
Yes.
much, Dr. Compoliti, for all of your clinical information. That's really helpful in setting the stage for what's next. So my name is Tanya, and I'll be taking over the second half of the presentation, hopefully taking about 20 minutes as well. But we're going to shift gears a little bit. Dr. Compoliti went over the clinical part, which is really helpful. And then the part that we're going to focus on now is organization. So I bet you're wondering, well, I know about Tourette, I know about my treatment team and my care team. How do I actually manage it? Well, it's really important that we address this piece because many individuals, as you know, with Tourette, have significant executive dysfunction. So that means that there's difficulties in organization and regulation in those pieces coming together just because of the prefrontal cortex in the brain that's affected. So my part of the presentation is going to be going over a little bit of a crash course in executive functioning coaching for organizations so that you guys have tangible tools to take away from today's presentation to actually implement when you leave here today. So as many of you already know, individuals with Tourette have difficulty with managing time and attention, organization, remembering specific details, the ability to switch focus, impulse control, and then integration of past and present information. So due to those challenges, it makes it sometimes very challenging to manage all of your care team appointments, reminders, lab reports, all of those things, because there's so many components of treatment. Next slide, please. All right, so this is what we're going to go over in this section. We're going to be talking about organization of medical records. So we're going to be going over how do you create a medical records binder, what are the basics of a medical records binder, and important information to keep. Next slide. All right, so what is a medical records binder? So it is essentially what it sounds like. It is a physical binder that is a 3-ring binder that holds all of your medical information, and it helps you to manage, document, and advocate for your medical health. You can also create an electronic version. So you want to definitely take this information and tailor it specifically to how you're wired and what your brain specifically needs. Next slide. Okay, so how do I create this binder? Like we talked about in the last slide, there's different versions. You can either do a paper or digital. I personally like to do both as backup, but let's start with the paper. So with a paper physical binder, for some individuals, they benefit from having a tangible concrete binder just because of, again, how the brain is wired, and having something physical and tangible helps them with remembering things, helps them to write on it, highlight, color code. So you want to use a heavy duty 3-ring binder. You want to use dividers and tabs to organize sections, and color coding is also really helpful. You can also go on Amazon. Amazon is great. They have these things already prepared. You can enter it into your cart, have it delivered to your front door, and taking the guesswork out of what you need. Now let's shift to the digital version. The digital version is essentially an electronic binder. It's just done a little bit differently. So some tools that you can use are things like Google Drive, cloud drives, flash drives, external hard drives, and other storage options. The way that you can organize your information, just like you would with a binder and tabs, you would organize it into folders and you would label it with the folder name, just like you would with a tab. Just make sure when you are using these digital storage options that they are secure, because this is your private information. So you want to make sure that nobody else has access to that information. Next slide, please. All right, so what are the basics? I know some of this may seem very common sense, but sometimes these basic things can be challenging to remember when you have so many different pieces of your care. So I find that it's really helpful if you can go ahead and create these things so you don't have to redo it each time you go to a new provider. Make sure you have your healthcare information accessible. Make sure you have things written down like your current health conditions, any allergies you have, medications you're on, surgeries you've been through, accidents, hospitalizations. Just having that information accessible makes your journey easier and makes the provider's journey easier as well in helping you. It's also very helpful to have family history. It's very easy to forget details of family history, but we know with Tourette there is a genetic component to this. So getting family history helps your provider to better understand your presentation and how to help you. Another information that's really helpful, and it's always changing, is having your healthcare insurance information. I find that it's helpful to take a picture of it and to also have the physical card, because sometimes things go missing, and every time you go to a provider, they're going to ask to re-verify your information. So be prepared for that. By having a copy of it in your binder or on your phone, having your policy information, having the phone number, claims address, etc., because they are going to make sure that your insurance is verified before your appointment is booked and before you actually check in. Just makes it much easier for you and your provider. Now, going back to your care team, like Dr. Compoliti already mentioned, there's so many different providers that you're going to have, and it's overwhelming the amount of providers. So it's really helpful to just have a list of the names, the roles that they play in your treatment, phone numbers, fax numbers, address, emails, just so it's in one spot so you're not overwhelmed with all of the information, and you know how to contact each of your providers and also help your providers communicate effectively. Another thing that's helpful is if you are on medication, it's really helpful to have your pharmacy information accessible to make sure that your doctor can send information seamlessly to that pharmacy, they get the right pharmacy, and you also know that where to pick up your medications, and just making that process more seamless for you and for the doctors. Next slide, please. All right, what are some other things that you need to keep? Having a medication log is essential. It sometimes is trial and error when you're trying out different medications and you don't remember what symptoms you have or what medication you're on or what dosage. So it's really important that you keep a log of that information. It's going to help you to know that you're in control of your healthcare, but you can effectively report to your providers the effectiveness of the medication, so that way they can best help you. So those things include the name of the medication, dosage, what's the purpose of it. I've worked with many clients that are on medications and sometimes they don't know why they're on it. So write those things down. So again, you are in the driver's seat of your care. Make sure you update this regularly. Medication is a trial and error process. So as you are going throughout medications, you can know what has worked and what has not worked. And you can make sure that all of your providers are aware of that. Make sure you document your need for refills. I encourage you to put this on your phone if you need to make sure that you get an appointment with your provider to get a refill if it's needed, because we don't want any lapse in care or in medication treatment, because we know there can be side effects with that. A symptom log. This is so important because we know with Tourette, things are often, it's like a roller coaster ride. So it's not going to be a seamless process. There may be highs and lows throughout your journey. It's a chronic condition. So it's very important that you keep a log of your symptoms. So that way your providers, again, can best help you to manage your symptoms and how it's affecting your life. So there's trackers that you can use. You could simply use, I think Dr. Compoliti called it a diary, whatever works for you, whether it's paper or on your phone in the notes section of your phone. Just keeping a record is going to, again, put you in the driver's seat of your care and help your providers help you. Next slide, please. All right. What else do I need to keep? So this page is going to be really unique to you personally. There are so many different providers, and depending on your symptomology and its presentation, you may not have as many of these things in your binder. You may not even know them. Some of you may also have many of these documents. But again, you want to make sure that your binder and documenting your journey is unique to your particular journey and where you're at in treatment. So you want to make sure any test results or evaluations are documented. And I recommend this be both paper and digital because you will need it, whether it's for disability, if you're in college and you need accommodations at your university, having those things accessible both digitally and backup in paper is really helpful to helping you get the resources that you need. If there's any other evaluations by a psychologist or any diagnoses or letters that you've been given, those are standard. You want to keep those. They're very important in making sure you get access to the resources that you need. Other medical documents can include medical notes, prescriptions, referrals. Legal documents could be a living will, medical power of attorney if that's applicable, and any other documents that may be related to disability, work accommodations, university accommodations if you're in school. And then some other things that you may consider keeping would be personalizing your binder to your unique condition, making sure that your binder is your holy grail. It has everything that you need in it. So when you go to your appointments, you have everything right there in one place and you are prepared to advocate for your needs. And it's really important that maybe you consider having a paper copy of a calendar, having a folder, pen, highlighter, anything that helps you to personalize your binder to your needs is very important too. Next slide, please. All right, so now we're going to shift gears to tips on how to manage your care. Dr. Compoliti already mentioned some really great tips along the way, but I'm going to add to that and probably reiterate some of the things she already mentioned. So we're going to go over how do you manage your appointments, resources to help you stay organized, and just some additional tips to manage your care. Next slide. Okay, how do I manage my appointments? This is probably the biggest question I get as a provider. I'm a licensed mental health counselor, and oftentimes appointment reminders are critical for my clients to show up. So we're going to spend quite a bit of time here because there's so many different tools that will help you to be successful. First and foremost, when you go to a provider and you book an appointment with the provider or the receptionist, put it immediately into your calendar, whether it be paper or into your phone calendar. Do it immediately so you don't forget. And you can also see if there's any conflicting appointments that day. It's better that you do that in the moment so you don't forget and you don't have to change appointments later on or miss an appointment. It just helps you to better prepare for the future and prepare for other appointments as well that I'm sure that you have. Like we talked about before, having two systems for your appointments, both digital and paper. Paper, sometimes we forget those little note cards with the reminders. It can easily fall or get misplaced. So highly recommend that you have digital because it automatically reminds you versus you having to find the appointment, and then also having a paper as backup. Many care providers have reminder systems already in place. So make sure you ask your provider, what are their appointment reminders? When do you get them? What's the method? Because most of the time you can tailor it to your specific needs. Many providers also have electronic patient health record systems. So that means you have access to your records pretty much 24/7, which is wonderful because you can download resources, you can download notes, referrals, things like that. Use those systems to best help you. It's really important in those systems, you can probably, most likely, I know at my practice you can manage your account and check settings for your appointment reminders. So a lot of my clients really prefer having text message reminders. They don't check their emails. So they can manage their care and their reminders by simply going into their health record system. Also, you're going to have many different health record systems because you're probably going to multiple providers. Again, it's really important. This is something probably to put inside your binder or in your phone, making sure that you have your logon information and passwords and websites to those particular health record systems. And maybe on your phone, you are putting all of those apps in a folder on your phone. Maybe it's My Care. Just making sure it's all in one place and it's seamless. Next slide, please. All right, so here are some additional resources to keep you organized. I found these online. I have not personally used them, but I think it's fantastic that you can basically take all of your care and put it in one place. So there's different plans that you can pay for, or I think some of them are free, but you can basically take all of your healthcare information and put it into a digital platform. So there is Everplans, MyChart, Health Companion, Care Passport, Follow My Health. And again, like we talked about before, going back to resources, use those reminder systems. If you need more than one reminder, let your provider know. If you need multiple methods of reminders, let your provider know. I know at my practice, I can allow my clients to have text reminders and email reminders. Sometimes I can send it to 2 people. So if there's a release on file, we can probably send it to 2 people, but you have to check with your provider and their electronic health record system in what capabilities they have. But most of the time, it is there and accessible to you, so just ask. Another thing that has been really helpful is color coding your providers. So say your neurologist is red and your mental health counselor is yellow. Keeping things color coded can help the brain better organize that information for future use. Next slide, please. Okay, so additional tips. Come to your appointments prepared. Write down any questions and goals for the meeting prior. I love that Dr. Compoliti had mentioned take notes before, during, and after. I think that's fantastic because you want to go in prepared by writing notes beforehand, your agenda, maybe keeping it to 3 simple questions or focuses for that meeting at most, writing down answers to your questions, and then when you leave there, making sure you're taking notes. Do I need to make an appointment with a specialist? Do I need to follow up by getting testing at a laboratory? Making sure that you're taking notes before, during, and after is really important to, again, put you in the driver's seat of your care. I think we just went over that too, taking notes during your appointment, remembering to do things after your appointment, and bringing a trusted family member or friend to assist you with appointments. If information is too overwhelming, it's okay to ask a family member or a friend to be extra ears and eyes for you. Most of the time, you probably will have to sign a release of information, but it's a helpful resource to have somebody else there who can help translate or just be a second pair of eyes and ears to help you to obtain information, ask questions, and use your time with your provider well. Another thing, ask for your records. They are yours. You have access to them. And a lot of times you have access to them in real time with these electronic health record systems. Something that I do often with my clients is signing releases of information. This is really critical to make sure that your care providers are communicating with one another. I work very closely with my clients' neurologists and other doctors to make sure that we are working collaboratively and making sure that the client is getting the best care. Because oftentimes my clients are seeing a psychiatrist for medication, neurologists to manage their tics, and they're also working with me on building their toolbox of skills to help them to be successful. It's really important that, you know, we're all working together to help this plane fly well. So make sure you're signing releases. Always keep copies of your important documents. Like I said, I'm going to reiterate it so many times because things, if they're paper, can go missing, and electronically, same as well. So sometimes it's just nice to have both as a backup. And when you go to your appointments, ask questions and do your research. You are your best advocate. We as providers, we know and we've studied, but you know your body. So let's partner together and ask the questions that you need to ask, report the symptoms so that we can help you to have the best care journey possible. Next slide, please. All right, so in summary, these are some things that we're going to review. You are a central piece of your care team. Be active, be involved, be your own best advocate. If you don't advocate for yourself and you're not assertive, nobody else will do that for you. You're at the stage of life where you're an adult, and if you're having a difficult time with that process, that's where you contact maybe a therapist like myself to help you with assertiveness training, because this is really key in making sure you get the care that you need at this stage of development. Like Dr. Compoliti already mentioned, there's many comorbid conditions that come along with Tourette. I work with a lot of my clients, not just on tics and CBIT, but I work with them on executive dysfunction. I work with them on relationship issues. I work with them on building a toolbox for how to deal with impulse control issues. So there's so many other things that come along with Tourette. Like we looked at the iceberg earlier, it's really important that we are aware of that, and we're also looking at that when you're thinking about your care team and your treatment. There's many providers to meet your unique needs. Find the ones that best fit your needs. It's not a one size fits all. Every presentation of Tourette is different. So some individuals may be mild, and then there's moderate, severe. So wherever you're at in that journey, make sure you find what works for you and find providers that align with that as well. I have worked with clients that some of them do yoga, some of them do alternative medicine. There's different things that work for different clients. And I even tell them, you know, if my approach doesn't work for you, that's okay. I want you to get the best care possible, and it may be a different approach that you need. Like we mentioned before, Tourette is chronic. It's much like flying a plane. Make sure you have the resources in place to help you, and those resources may and will change throughout time based upon your needs. So be prepared to pivot and adapt and adjust. Identify your support system and healthy coping skills. This is really essential to enduring and thriving with Tourette, is making sure you have a loving, supportive network of friends and family, making sure you have great coping skills that may differ throughout the lifetime with Tourette, but making sure that you are constantly adapting and adjusting to your needs. Like we talked about, executive functioning challenges can make care management really difficult, but that's where there's lots of technology available to us to be a great resource to helping you to manage your care better. Know your brain and get your information organized. It will empower you and help your care team to help you. I will tell you, a lot of my clients that have Tourette are across the spectrum as far as functioning, and the thing that helps them the most is when they are empowered, educated, and they're in the driver's seat of their care. The more that you are in the driver's seat, the more you are owning your life versus allowing your condition to own your life. So please be an advocate for yourself, get in the driver's seat, ask for help. There's plenty available to you. And then document. When in doubt, document it, whether it be writing it out in a notebook or in a log, whether it be on your phone. I like the recommendation Dr. Compoliti mentioned, recording things. If writing is difficult for you because maybe you have dysgraphia or something like that, maybe you can do a voice memo, and maybe you can do voice to text. There's so many different resources available to help you to document your care well. Find what works for documenting. For some people, they prefer paper. Other people prefer digital. We really just want something that works for you that you can be consistent with. So take this information and tailor it to your specific needs. And Next, we want you to just identify 1 to 2 problem areas with your care management and problem solve solutions to better help you. So as we're wrapping up our presentation, I want you to stop right now and just I always have post-it notes, take post-it note and just write down 1 or 2 problem areas with your care management right now. Is it appointment reminders? Is it organization of your materials, of your documents? Is it being confused because doctors talk too fast or there's not enough time? What are the challenges that you are having in your care journey? Once you've identified 2 of those problem areas, I want you to problem solve what could be a solution. Maybe it's something we talked about earlier. Maybe it's something that you don't have an answer to, but you can maybe ask it in the Q&A. Maybe it's something you can ask a family friend to help you problem solve. But we want you to identify those problem areas again, so it's not an ongoing problem and you feel like you are in the driver's seat of your care, where it's more seamless and it's easier for you to get access to your care. And then final point is, when you're more organized, you're less stressed and anxious. So in turn, that leads to a better mental health. And we know that it's all of these components are a big part of Tourette. And if we can help in one area with organization, that will help you to be less stressed. It will help you with your executive functioning. It will help you with your relationships because you're not overthinking about appointments. All of these little things do matter, and it will help you to, again, having better mental health for this journey. Next slide, please. All right. Now we're going to.
Thank you. Thank you guys for your insight and expertise and all of those helpful tips and tricks. We are now going to begin answering the questions submitted during the discussion. As a reminder, you can still submit your questions at the bottom through the chat box. If we're unable to get to everyone's questions here at the TA, we do have a full-time information referral staff member who can answer your questions via email at support@tourette.org or by calling 1-888-4TOURET. And I will put that in the chat because I know that was a mouthful, so that you guys have that information. But the first question for our panelist is, what to do when your primary care doctor assumes all your problems are caused by tics?
Yeah, I mean, I guess I have to take that. So, I mean, there is a limit to that always. They cannot say like your urinary frequency is caused by tics. But I mean, as we saw that iceberg, it would be reasonable, not solely by tics, but a lot of problems can be caused by Tourette's. I mean, there is a spillover. We're talking about anxiety, mood disorders, executive dysfunction that comes with ADHD. All this. Then, if you can't sleep and your primary care tells you, that has to do with your Tourette's or the medications you're taking for Tourette's, there is a point there. So I would say that, I mean, it's frequent. There are 2 sides to this story. It's frequent that doctors, if you have a chronic condition, people tend to throw everything on it. That's caused by that, and this is caused by that, and that's caused by it as well. But that's true up to a certain point. And I think then, that's why you need somebody who knows Tourette's and knows what Tourette's can do. But then they need to know the other information, your whole person. They need to know that you have high blood pressure, and like I gave you a medication that makes you dizzy because it drops that. So then all these things are interconnected. So you need your Tourette's doctor who knows what is Tourette's and what's not. And a lot of things, that bottom of the iceberg can be Tourette's. But you need the primary care doctor you need somebody who sees the forest, because truly I see my own tree. And you know what they say is that if you have a hammer, everything looks like a nail. So I think both perspectives can be helpful in managing your care. And sometimes you need to have your doctors talk to each other. It can be hard, but it can happen, right? I have to say with Tourette's, I talk more to psychiatrists than primary care doctors, but you own that piece about you. You have to make your doctors talk to each other if they're throwing the ball to each other. That's what you need to do, actually. You have them solve it among themselves. They shouldn't be putting you in the middle of that.
Okay. The next question is, early on you mentioned that Tourette syndrome causes issues with executive function. Do you mean that's totally separate from ADHD, or because ADHD is a comorbidity of Tourette syndrome?
Want to take that, Tanya, or you want me to?
Sure.
Yeah.
Absolutely. Executive dysfunction happens with ADHD and with Tourette. You can have Tourette, and we know it oftentimes is a triad, right? It comes with often ADHD or symptoms of ADHD. So yes, executive dysfunction in my experience has been a key piece in most of my clients that have Tourette, and most times have ADHD as well, diagnosable. Did that answer the question, Marissa?
I hope so. I hope so. We'll see if she comments in the chat if she has further questions.
Okay.
This person said it's a lot of information, but essentially the tics came on in adulthood, so it's only been sporadically mentioned at the doctor. They worry about having it on the record and then having it held against them in some sort of situation in the future. For example, this person was riding the scooter and got hit by a car and was afraid if the driver's insurance company found out that they had tics, that they would try to blame it on this person rather than or though that they know that they had nothing to do with the situation. So I think they're just trying to figure out kind of a little bit of that disclosure. You know, do you tell your doctor? Do you tell other people in different situations and have it be on your record? And could it be held against you in some sort of situation?
I mean, yeah, healthcare records are supposed to be confidential, but your life insurance person has a right to know that before they insure you. If you go out there and injure somebody, they have a right to know your medical record, or they can subpoena it. So I mean, I think the way to go about it, I think in life, it's easier to defend the truth than it is to defend the lie. You are who you are, and Tourette's or tics is a small part of it. It is what you make it to be, and you're many more things than your Tourette's. And I feel that getting it in your record and getting appropriate help if you need help is more important than trying to hide it. I think it directs a lot of good energy. It wastes a lot of good energy towards the wrong direction, trying to not have things on your record just because you can be labeled. Yeah, I think it's up to us to be who we are and stand as individuals who happen to have Tourette's, who happen to have Parkinson's disease, and you can defend that. Although I think with Tourette's is the tics are not as often the problem. ADHD could be more often the problem with that, right? Or the impulse control, or the socially inappropriate, non-obscene, socially inappropriate acts. Sometimes that can be common in Tourette's, but judging from the children, and I don't know how that is in adults as much, is like sometimes you are penalized for things you do that are not your fault, is your disease. So I think having that in your record can be more helpful than harmful on your defense. And you see that in the school, in the classroom all the time. you just make noises and the teacher will tell you, shut up. Why can't you shut up? You're making noise. So there, this disclosing that you have a condition can help you. I mean, people that have been, written up at work for saying, the F word or the N word. I mean, knowing that this could be a condition can help you more than hurt you there. So I've seen more instances in the almost 30 years I've been doing this where it helps you rather than it hurts you, disclosing what you have.
Yeah, I agree with Dr. Compoliti that I think that the benefit outweighs the risk in this situation. Again, this sounds like a very unique situation, but Tourette is protected by the ADA, and it is something that can help you long-term to get resources, information, disability, if that applies to this individual. So I do think that documented has far more benefit than risk involved. And then again, going back to mental health, sometimes by not disclosing it, there is kind of like this darkness, like something is hidden, and that could have impacts on mental health as well. If we feel like we're not able to live in this place of light and being able to be honest about who we are. So just another point to take with that question.
Totally agree.
All right, we'll do one final question. How do you find doctors such as psychologists or neurologists who specialize in movement disorders? I search for hours to find that any possible doctors don't take my insurance or they're located in a different state. I've been to many doctors who make me feel like they are just guessing and throwing their favorite treatments at me until I leave and look for someone new.
I mean, can I take this? Yeah. So I think the Tourette's Association can be a very, very good source of information. They have a referral list online, and I believe, correct me if I'm wrong, Marissa, they have a person that can reach out trying to find you a provider or a doctor if you send. They, as you said, they have one full-time person answering questions from members. So looking through that list, I mean, it's a good way to start. I do agree that navigating the medical profession can be really hard. And especially mental health has been very difficult the last 5 years especially. So I think it's easier to find a movement disorders neurologist than it is to find a psychiatrist who you have access to and who doesn't, he's not in private practice charging like a divorce lawyer, or finding a psychologist that has some experience and can meet your needs. So I think psychology today is a great tool also, but even there though, you have to kind of search and look at profiles. And sometimes, finding a doctor, it's chemistry. And then, somebody can have the best credentials and you walk into that room and you don't have the chemistry. Even more with a psychologist, somebody you have to open your heart to, so you just do it and you eventually you'll get it, I think, and use all the tools that are available to you, like the patient organizations, Psychology Today, even, sometimes your neighbor who's seen a good doctor. But again, it all comes down to that chemistry in the room that doesn't always have to do with credentials. Tanya?
Yeah, I wanted to piggyback on that. I agree with you on that. It is about chemistry and finding the resources. The Tourette Association website is a fantastic tool to help you to find providers within your state and area. Another thing is to look for the Tourette Centers of Excellence. I'm located in Florida. I think there's 3 or 4 of them in Florida, and a lot of times you can call them and they may have experience with people within their state that may not be on the website but are knowledgeable. Most of the time they are listed as providers, whether it be mental health like myself or neurologist or psychiatrists. So it is helpful to use those Tourette Centers of Excellence. They're a great point of resource for your area, and sometimes have more information about more local resources than maybe the larger scale of things. So that may be helpful as well to use.
Thank you, guys. I did put links in the chat to the Find the Provider link from the TAA website, as well as the Centers of Excellence locations for you all to check out. I did include the Psychology Today search in there as well. So thank you both again for a wonderful presentation. This is all the time that we have for our webinar today. Once the webinar is closed, you guys will receive a survey on the presentation. We would greatly appreciate it if you would take some time to complete that and provide your feedback to us. You will also receive a follow-up email within 24 to 48 hours with the link to view the recording of the webinar. The webinar will also be posted on TAA's YouTube channel for those who are unable to participate, or if you want to share it with somebody else that you may know in the future. But lastly, we encourage you to reach out to us at the TAA about this webinar or other ideas or suggestions that you may have. Again, on behalf of the Tourette Association, thank you again for joining us and for taking time to view our webinar. Have a great evening, everyone.
Good night.
Bye.